Good afternoon. I'm Myron Douglas, a health communicator within the Division of Environmental Science and Practice in the National Center for Environmental Health at the CDC, at the Centers for Disease Control and Prevention, or CDC. I'd like to welcome you all to today's Nexus webinar, Putting Radiation Plans to the Test Using Cooperative Games for State and Local Radiation Exercises. There will be a presentation and a Q&A session with the speakers. All participants joining us today are in listen-only mode, and there are closed captions available for this webinar. Next slide, please. Today's Nexus webinar will be available to view on demand. You can find the video recording from today's webinar on CDC's Nexus page at cdc.gov/NCEH/EHSP/EHNEXUS, or by clicking the link in the chat or scanning the QR code on your screen. We'll give you a quick moment for that. Next slide, please. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button on the bottom of your screen and then type your question in the Q&A box. Please note, we often get more questions than we can answer during a live session. And if you are a member of the media and you have a question, please feel free to contact CDC Media Relations at media@cdc.gov or at 404-639-3286. Next slide, please. Please note the findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the CDC. Next slide, please. I am delighted to introduce today's presenters. Lauren Finkley, she is a health scientist and an acting team lead within the Division of State and Local Readiness at the CDC. We have Jamie Moore, who is a threat preparedness program manager at the Monongalia County Health Department in West Virginia. From Austin Public Health, we have Marlon Haygood and Ashley Haas. Marlon is an emergency plans officer and Ashley is a disaster epidemiologist. And lastly, we have Elizabeth Garassi, who is the director of emergency management at West Virginia University Medicine. Now it is my honor to pass the mic to Lauren Finkley to provide us with some background on This Is a Test. Lauren, the floor is yours.
Thanks, Myron. Next slide. So when we were looking at developing this as a test, we noticed that there was a need for collaboration and cross-sector coordination. And looking at radiation emergencies, you note that this involves all emergency support functions within the National Response Framework as shown here. Next slide. In a recent poll looking at the public health workforce training gaps, 38% of the public health workforce said that they felt that cross-sector partnerships was a training gap, meaning that they were unsure how to work with partners, how to reach out to partners, and maintain those relationships. Next slide. So how do we work with partners and, build those relationships? Usually there's exercises, and types of exercises include discussion-based exercises such as tabletops or workshops, or operational-based exercises such as functional and full scale. Next slide. But neither of these options provide the necessary consequences and realism that is required for developing these partnerships and training. And here's a quote talking about that these other exercises don't have the stress and the volume and the speed of decision making you need to actually train for crisis situations. Next slide. So that brings us to T.E.S.T. So we propose that T.E.S.T provides a realistic training experience that's engaging, stressful, and fosters this cross-sector collaboration among preparedness partners. There's widespread implementation of it would result in well-trained, well-prepared personnel for emergency response. And this well-trained workforce could lead to a reduction in lives lost and better outcomes during an emergency. Next slide. And, I mentioned those different types of exercises, but one that's not commonly used is right in the middle, and that's games. So gamification, or using game elements in building games, actually has several benefits, such as integrating learning and behavioral models, such as self-motivation theory. People want to do well, people want to win. There's evidence of increased engagement and knowledge retention. When something is exciting and different, usually you recall it better. And then it also provides this environment for rapid decision-making with immediate feedback and consequences. Next slide. So that brings us to the design and development of This Is a Test. Next slide. So, keeping in mind, we wanted to create this really engaging exercise format that would foster collaboration, that partnership, but we also wanted to mimic realistic and very complex emergency response for radiation emergencies. So, along with all those other objectives, we also wanted to help with the knowledge retention, since radiation is not something that's exercised as often, and then having that overall capacity improvement for radiation emergency response. Next slide. So one of the first steps was translating tabletop exercises into a game. And when you look at the core elements of a tabletop exercise, there's always a scenario, some injects or problems you have to solve. Every agency has their own role, and there's an objective you have to meet, or several objectives. And then when you start looking at game components, there's lots of different games out there, but one format's cooperative games, so working together. You have limited turns, it costs something to do an action. Usually they can happen in real time, there's some that aren't. They probably have a scenario driving the game or wanting you to, making you play. And there's often role playing. And then looking at learning design models, since we wanted this to also be like an educational exercise training experience, we looked at Bloom's taxonomy, Kirkpatrick models, and collaborative learning. So moving from just learning something to applying it and truly enabling you to do that later in the future. Next slide. So we'll walk through kind of the different elements and why we chose them. So cooperative games foster collaboration. We decided very early on that we wanted to make a cooperative game because group winning helps remove a single player from their own objectives, and you have this fostered sense of shared goals and motivation for winning. There's no, I in team. The asymmetrical player abilities, though, helps every person feel unique and bring their own agency roles to the game. So they have to bring their unique circumstance to help succeed. And we also created a rotational leader role because we wanted to make sure that every person at the table had a voice, and then people wouldn't be quarterbacking or one person telling everyone else what to do the whole time. So this increased that collaborative nature. Next slide. When we thought about designing the actual board, we really wanted everyone to be able to visualize the flow. So This Is a Test is focused around a community reception center, which is where you would go to be screened, decontaminated, and registered after radiation emergency. And to visualize that flow and that process, we actually thought of a simplified flow diagram that you see here. And that way you actually learn decision pathways for how people should move through whatever the setup may be. And we also have these limited turns, so you can actually visualize this countdown until when the game ends. Next slide. We also designed a status tracker, so that consequence piece that was so important that some of the exercises were lacking. So instead of creating, one consequence, we wanted there to be multiple meters, and this shows similarities to real emergencies have all of these different facets, and you have to balance all these different needs. So it creates this stressful situation to balance hazard or safety issues, anxiety, or like the public's sense of anxiety, and then like player fatigue or personnel. We also wanted to create rewards. So being proactive in the game helps you have a better response later. And then consequences. If you are not fulfilling certain things in the game, then the situation gets harder and harder to resolve. Again, showing the compounding stressors and creating some urgency, much like a regular response. Next slide. So every player has their own actions, and this was something we wanted to help people learn tasks that they might be responsible for at a community reception center and what their responsibilities might be. Every player has a self-care action in the game, and this is to highlight the importance of self-care and promoting healthy behaviors in staff. We also have these multiple player actions, so lots of different options. That way you can see the range of duties someone could do at a community reception center. And then every action has a cost. And so the more difficult something is, then there's a higher cost to do it. Next slide. One of the key things in the game is inject. So we have those in tabletop exercises and other exercises, but here these are cards you draw. And injects are really what drives that group decision making. So you have inject cards as seen on the right. There's usually some title, narrative text, and then some action text where you make some choices and you have to weigh what it's going to be. So players vote and they discuss among each other what the best option is. These multiple choices also allow them to see there's not always a best or easy answer. Sometimes neither of them feel great, but you have to do the best you can. And every round players draw multiple injects. That way they have to triage and deal with competing priorities, such as an irregular emergency. Next slide. Another thing we wanted to highlight was the need for resources and people moving through the community reception center. And we chose to use Meeple. And Meeple is a board game piece. There are many people. And so this helps show bottlenecks and lines. So we have these resource limitations. We start with a very limited resource situation because not every response has everything they need all at once. And the realistic capacity of the actual game, we align this with our simulation software, CRC Simpler. So the lines that build up in the game actually would build up in the simulation software, so it mimics real life. And these lines are visualized by the different meeple being in line, so you can actually see them develop over time. And players can help identify, actually, we need to buy another portal monitor, or we need more registration desks. Next slide. Another key component of the game was integrating access and functional need considerations, and we did that in a couple different ways. We had different meeple colors, and we wanted to highlight the percentage of the population who may have access and functional needs and require additional assistance and time to process at the CRC. And this goes to something we've seen in actual functional and full-scale exercises. A lot of times, the access functional needs community is not majorly represented there. And so we wanted to bring attention that you need to make sure to take considerations and to have adequate staffing and resources to help everybody. We also have inject narrative cards where we have a wide range of these narratives to promote discussion about different accommodations and reception center procedures. So an example here is a meeple with limited mobility requires decontamination and needs assistance. And so talking through how would we do that and like what other resources might we need for this accommodation. Next slide. And one thing we always like to show is just the development process. So on the farthest left is the original game design, and then it kind of started becoming a little bit more like a board game, less like an engineering design. And then the creative services at CDC did a great job of turning my hand drawing into an actual game, which is what you see on the right. Next slide. We also had similar things for the status meter. So we, went back and forth with, how should we display these different statuses? What should we call them? What's the right words? How will we convey these messages? And through lots of iterations of play testing and getting feedback, we were able to land on the status meter you see on the right. Next slide. So the outcomes of this as a test is this facilitated discussion and identification of gaps in community reception center plans, looking at those safety hazards, the population needs, and what the requirements are for staffing, and building this collaboration and improvement of communication. We'll talk about feedback later, but collaboration and communication are the biggest words we usually hear back. And the understanding of current and predicted throughput capacity, so where those lines are going to build up and how to deal with them. And then simulating the resource constraints and bottlenecks, so not having everything you need all at once and having to work to solve the problem. Next slide. And with that, I'm going to hand it over to Ashley and Marlon.
Hello, hello. Good day, everyone. My name is Marlon Haygood, Emergency Plans Officer with Austin Public Health, and I'll be talking a little bit about our experience with This Is a Test. Next slide. So I want to start with talking a little bit about who we are and where we're coming from as we talk about our experiences with This Is a Test. So Austin Public Health is the local health department for Austin and Travis County. We have a population of over 1.3 million people, a big mix of rural and urban. We're the capital of the state of Texas, and we have a lot of large attractions and institutions such as the University of Texas, events like Austin City Limits and Formula One. As the health department, we have over 700 employees, performing routine services such as epidemiology, environmental health, and social services. However, in Texas, the Department of State Health Services is the Texas Radiation Control Agency, responsible for inspection, enforcement, and emergency management. So it's not something that, as the local health department, that we had a lot of experience with. Next slide. So not having a lot of experience is the state we were in when we were invited to participate in Cobalt Magnet 2022, a national level radiation exercise planned by the Department of Energy, and the city of Austin was very excited to host this exercise that takes place over multiple days of play. There's hundreds of responders participating from a number of different agencies, but this was going to be our introduction to radiation response. So, noting that this is a full-scale exercise, boots on the ground activities, we knew we had a lot to learn before we would be ready. Next slide. We were starting at the basics. One of our first step was figuring out what our responsibilities were, what our task would be. We learned what population monitoring was, what a community reception center was. Additionally, as the local health department, we had roles in sheltering, family reunification, and multi-agency resource centers for the provision of recovery resources, all of which were different aspects of radiation response that we needed to figure out. There were some gaps in our knowledge. We didn't know what a radiation emergency would look like or how we would respond. We had some folks on our team who were still learning the basics of radiation, what it is and how people can protect themselves. In the context of those limitations and our current knowledge gaps, we spent a lot of time discussing what our level of play would be for CM22. We knew that we had a bit of time where we could plan something like a seminar, but we wanted to make sure that we could train everyone who participate, know what plans we had available to consult and what plans we could develop. And at that point, jumping to a full-scale exercise seemed like something that would be quite a big lift. Next slide. So we did have a bit of time, enough time that we were sure we could get our our emergency preparedness team to participate in some seminars, take trainings, perhaps have a seminar for our leadership as well, maybe even a workshop. But the jump to a full-scale exercise seemed a bit beyond us at the moment. However, a few individuals on our team had some experience using games as a training tool. And of course, that's such a fun idea. We latched onto it right away. We were lucky enough to be introduced to a radiation professional and board game enthusiast in Lauren Hinckley. And from there, we were in business. Next slide. So quick run through events and the time periods. We have several events on here that are planning meetings and workshops for the CM22 exercise. Looking in early July, we had our command and control workshop leading into our midterm planning meeting, the master scenario event list scripting for the exercise, and a few other events that were also part of CM22, including the final planning meeting, or finally in May 2022, we would get to our full-scale exercise. In that time, we were able to fit in a few events of our own, trying to, as we actively prepared for the exercise, made sure that we were training our staff, holding events for our leadership as well. We would get to the counterterrorism operational support specialist to perform a training course for our staff. We hosted a bit of a tabletop exercise, and we had a seminar, a public health radiation response seminar that we organized for our leadership in the local health department and some of our community partners as well, such as our neighboring health departments, our partners with the local schools. We were able to leverage that seminar into a workshop as well, where we'd had a lot of experience with pod planning, for our points of distribution for COVID and other vaccines. So we were able to use a lot of that experience using the pod to CRC toolkit developed by the CDC to start putting something together, a draft of a community reception center plan that we would have in play before our expected and what was initially planned as a full-scale community reception center that we would operate during the cobalt magnet exercise. Next slide. So when we reached May of 2022 and the cobalt magnet exercise, we were ready to play with some limitations. We had two main goals, which was training our staff and our partners and participating as much as possible in the exercise, generating content that would allow the other organizations participating to participate to their fullest extent. In the morning on the day of, we had a drill with the assistance of our Department of State Health Services, where we set up a simulated community reception center. We got hands-on training using the detectors and equipment that would be used at a community reception center. However, we did not have actors and we didn't do it full scale, but we did something that worked for us and still let us get a lot of great experience. Though in the afternoon, that's where we went a little bit more in depth and we had the opportunity to play This Is a Test. We used the CM22 exercise scenario of a radiation dispersal device as our scenario for the game. We had the opportunity to use our previously developed toolkit to guide our actions, identifying strengths and weaknesses in that current plan. For example, we noted weaknesses in our own plans for provisions for pets. And we realized we would need to have some more in-depth discussions regarding the provision of clothing. So the visualizations in the game and acknowledging the injects that address the needs of folks with functional and access needs really let us put our plan into context and note some future provisions that we would need to make. Most importantly to me, we got to exercise to the fullest extent, inviting many of our partners to participate in this portion of the exercise. We had our neighboring health departments, we had our state radiation program, we had the local schools that we often partner with for emergency response. These are the partners that we'd call in a real event. And this was a chance for us to use this game to exercise and plan together. We had our limitations. We weren't doing a full community reception center. We worked within those limitations to get the greatest benefit we could, which I think that relationship building was one of our greatest successes throughout this entire process. And now as well, my fellow presenter will talk a little bit more about the ways in which we used This Is a Test during the exercise.
So next slide. We had multiple board games going on at the same time. We were essentially the pilot for This Is a Test after working with Lauren and the CDC to develop it. And so the throughput that we were able to calculate with the game, being able to act like each meeple was an individual person coming through, allowed us to have each individual board game as a community reception center. The CM22 exercise was multiple days long, and so we were able to act like each one had its own problems and issues, and then that allowed us to further engage with the exercise overall, and be able to use the toolkit to make like requests to our emergency operations center for different types of like logistical items. It also allowed us to look and see what we might be missing as we were making requests. And also the numbers, we were able to use tools that we mentioned earlier that we had training on, like the RAD responder, which is a data sharing tool during a disaster, a radiation disaster. And so we could simulate based on the data that we had from the games themselves, how many people were externally contaminated, how many people might have been pregnant, how many people had challenges overall, what kind of challenges were existing. Did we need resources for pets? Did we need extra resources for children? Did one of our portal monitors go down and we had to fake like requesting new ones, and how that would work? So being able to also use the data from This Is a Test was a really big boon overall for us to understand how it fit in with the rest of the response, especially since this was our first times doing it, but then also how it might connect in other ways that we hadn't looked at yet. Next slide. And what was a benefit too is that we played out of sync. And so the CM22 exercise was a week-long exercise, and traditionally based on the flow of the exercise overall, we probably wouldn't have activated community reception centers until Wednesday or Tuesday or Wednesday of the play of the exercise. However, we had our exercise and our multi-part day happen on Monday. And so that allowed us to collect and give information on a day we probably wouldn't have been doing many things. And then our team was able to enter this data, request things, participate in the emergency operations center, participate in other activities happening throughout the week that allowed us to further our knowledge for radiation response overall. And then we used the data to push forward some of the other actions that were happening in the exercise to the information to the CDC, information to the state, information to the Department of Energy about what's going on, the people affected, how they're affected, and changes that might need to be made. We also were able to use our toolkit that was developed that Marlon mentioned, and we were able to put web EOC requests, which is how we request new like logistical items. And then we were able to activate our own DOC, our own Department Operations Center, which allowed us to talk about internally how we would respond, not just working on a community reception center alone. And this was a really big benefit overall, just being able to see the rest of the exercise without being inundated with just running a community reception center alone. Next slide. So our immediate takeaways in our experiences with the CM22 and the game was that we had This Is a Test as a game right away. We were able to play it again. We've been able to share it with surrounding counties who participated and use it again. We also were able to finalize and test the toolkit. And so, like Marla mentioned, there were a few things we need to change, but that allowed us to use just like a formal tabletop, just like the whole process where you saw the building blocks, actually test it and make sure that we can go and build it and improve it again for the next time. And then this was also a big lesson on focusing our own capabilities and bandwidth. We were doing this still within planning and like responding to COVID and being able to say as a local health department to like federal governments who do this regularly, hey, we're just not able to do this. And that allowed us to actually like push back and also set our own boundaries that gave us a better response and like a better experience overall. We are still working on using this as a test to train our whole department. So planning different scenarios and like running through and having people understand what radiation is, how it affects people, and how a community reception center would be used for radiation response. We are planning a full radiation response tabletop exercise that goes a little bit more detailed than just a community reception center, but planning on using that in there as part of the building blocks of everything. We also completed a regional radiation response plan that allowed us to partner, like Marlon said, with all these great building blocks with these other communities and health departments in our area. So we know how we would respond together. And then eventually in the future, our plan is to have a full-scale CRC exercise where we test all of these pieces and build it all together and connect the dots and make the puzzle complete. Next slide. Anyway, this is our contact information. If we'll obviously also be available in the future. And so we're going to pass it on to our partners in West Virginia. Next slide.
Greetings, everyone, from Montague County, West Virginia. I'm Jamie Moore with the Montague County Health Department, and my counterpart, Elizabeth Gracia, will be jumping in here on some slides as we move forward. Next slide. A little bit of who we are. Mon County Health Department, Montague County in West Virginia is a northern county, about 106,000 people. We are home to West Virginia University, the city of Morgantown, and we are home to the mothership of WVU Medicine as well. We are a mix of urban and rural. We've got a western frontier that is actually several miles out on some very not very good roads, so it takes a while to get there. But some of our problems are that, we think about, we are just south of Pittsburgh, about 80 miles. So there's a lot of people there. That's about 70 miles from our closest nuclear power plant, which sits on the border of that little finger, West Virginia, that sticks up there, that northern panhandle. And we're also about 200 miles from DC. So, and we're at the crossroads of I-79 and I-68. So we got an east-west and a north-south interstate that meet in our county. And if there happened to be a western migration from some type of event, like nuclear in DC, once you jam up the roads, we're about a day's drive away and you're going to run out of gas right about our front door. So we worry about those things. Next slide. The Mon County Health Department, the Montague County Health Department is about 104 employees. That fluctuates up and down because we're not at 100% capacity right now. Like most people, we're hiring as we go. We have one prime location, but 8 satellite sites. We have 5 programs are operating: clinical, environmental, dental, WIC, and of course, threat preparedness. And I'm going to pass over to Elizabeth for the next slide.
Thanks, Jamie. So as Jamie said, I'm with WVU Medicine, and our flagship or academic teaching facility is J.W. Ruby Memorial Hospital in Monongalia County. We are fortunate enough to be located in very close proximity, almost right next door to the health department. But WVU Medicine's reach is beyond Morgantown. We have about 25 hospitals in the system, some in Pennsylvania, some in Maryland, some in Ohio, as well as throughout the state, along with some clinics. So we do have a large reach, but we know being a tertiary care facility, we are going to be on some of the front lines of some of the worst injuries and some of the incidents that occur and things that we are concerned about. You can see from that picture where we're taking that picture from, we're standing right on the front gates of our football stadium, our university football stadium. So you see the only thing that separates the hospital and a football stadium full of 70,000 fans is a parking lot. And Jamie will talk a little bit more about kind of the role in radiation detection that the health department does. But obviously there's a lot of concerns in addition to the ones that Jamie already mentioned that we have about some of the mass casualty incidents. And when you throw radiation or an event like that into the mix, we have to do a lot of planning. Next slide.
So threat preparedness programs in the state of West Virginia are organized as regional activities. We are a part of the Preparedness Action Coalition team, or PACT as we call it, which is 6 counties in the Northern Panhandle. And the Montague County Health Department is also the coordinator for that regional action. So we have this long history of collaboration that it's in county and also out of county and we routinely meet and work together on all kind of problems. Next slide. One of the prime examples of our collaboration recently came out of the COVID response. You see the hospital coalition maps on the right. They're also organized regionally, and we are members of that as well. But on the left, you'll see the Greater Montague County COVID Vaccine Clinic, which was a community collaboration with 5 managing partners, which include WVU Medicine, Mon Health System, the other hospital system in our area, the Montague County Health Department, the Office of Emergency Management here in the county, and also one of our rural health centers from out on that western end that I talked about. And really, in this collaboration is when we started to kind of get our sea legs and really came together to solve a big giant problem, just like everybody else that we were having in our community that was COVID. But that has really sprung us forward. And as we move forward in other collaborations, and there are many in many different directions, and they involve many more people than you see sitting here talking to you. But really all this has growing quite rapidly from that shared interaction that we brought together to fight COVID. Next slide, and back to Elizabeth.
So in addition to the initiatives that Jamie pointed out that we collaborate on, another one is our radiation injury treatment network status at the hospital. Many of you are familiar with that network. I was not coming into the hospital. I'd come from a smaller hospital in the Midwest, and the first time I had heard of Written was when I came to WVU Medicine. So I knew it was something that I needed to learn more about. We had done previous exercises with the health department, but really wanted to continue to build on those relationships and the partnerships that we had established working through COVID and on some of the other initiatives, especially, post-COVID, there wasn't a huge appetite for doing exercises, right? We were burned out. We've been living in this surge for, a couple of years now. So everything, wasn't just doing drills anymore. Every day we were living it. So we wanted to get back on track. And it was a great time because obviously, as all of you know, with the ASPR budget period, the radiation was a deliverable, the radiation surge plan. So we needed to come together and ensure that our community was prepared, and that with the turnover that occurred in COVID, that we did have people up to speed on what some of these plans were. Next slide.
So part of who we are, the Montague County Health Department is home of the Northern Radiation Response Team, which was a team that was established through a activity of the state health department providing equipment, and we at the local health department standing up personnel and starting to train on that mission of dealing with radiation incidents. It's part of our overall mission of CBRNE. We have put a lot of time into it over the last coming up on a dozen years now. And we have built some extensive capability to be able to go out and support the written, support other activities that are going on or needs in our area. We are an area that had a lot of Marcellus gas development. There's a lot of radioactive tools and also radioactive waste products that were generated through that activity. And we also do support missions for, like Elizabeth said, during the ball games. We're there doing radiation monitoring and just making sure that, that everything is safe and no one's trying to do something nefarious during that event. Next slide. So having done this for about a dozen years, we've had lots of opportunities to exercise with our partners. Here are some of the examples of those. They're full-scale exercises all the way down to tabletops. Our gameplay was the first time that we had done that. and it worked out very well for us, and actually probably raised the bar on what our partners expect us to be able to pull off on exercises. So that's a good thing, though, because it was a good day. Virtually nobody thought that they wasted their time in that event. But we certainly focus on building that community expertise to be able to support our community in case of a radiation event, and then building capability, capacity, and then of course establishing collaborations. It takes a lot of energy and a lot of effort to maintain a radiation program, and a lot of training. So you have to have some dedication there, and you have to continue to grow that team as we go forward. Next slide.
So as we mentioned, a lot of training together. And one of the opportunities that we had to do, and we actually strategically planned our exercise right after we had our CTOS training, brought in by the Healthcare Coalition, again, as part of our ASPR deliverable. But we trained together. There was about 60 of us over the course of 3 days, looking at those 3 courses. And it involved all of our key stakeholders, all of our main players in that incident, that radiation incident, being public health, hospitals, first responders, and emergency management. We felt that this was really beneficial because we did the training 1 week, and then the following week we had our exercise. So it was fresh in people's minds, and they could actually see in using the game how these concepts would have played out in an incident versus just going through, a PowerPoint or, having some discussion. The game really focused in on, yes, this is what it would look like in the real world in an event. And it gave a better understanding for all of those participants to, again, have that training, have it together. So they were already, thinking along those lines, and then do the game together. Next slide.
So part of the training that we do at the health department, and also with our partners, because we are constantly trying to bring trainings here and engage more collaboration in our community across all the different disciplines of emergency response. But right now we've identified 49 courses. It's about 820 hours of total training. So you're not going to do this next year. We have certainly capability to do the community reception piece. We can identify isotopes. We can do a whole lot of stuff around providing support and expertise. One thing we don't do is we don't clean up stuff at this point. But there have been numerous times in our community that radiation has or radiation accidents have come to happen. An example of that is that pig that you see sitting up there in the middle of one of our highways that was got there because as a result of a truck accident. That is a industrial radiograph. Next slide. So exercise development is something that Elizabeth kind of said, hey, you guys want to play together? And we said yes. So I'll pass this over to Elizabeth to talk about.
Yeah, so had the great fortune of being able to meet Lauren at the written workshop, and she presented on what the game was and the concepts and how it would be used, and was just immediately drawn into it. And knowing that we partnered with the health department on so many initiatives and with their capabilities, this was something that we could really bring back to the community. So, and thankfully Lauren was on board, and we were able to pull together a planning team, again, looking at our key players here who would go through this. And on the left side of the screen, you see just our flyer and our registration, but bring together, again, first responders who include, police and EMS to help plan this, along with our CDC partners, FEMA, NACHO. They were all really involved in the planning process, which really simplified it for us at our level, at the community level, because they've done this before. They were able to get us a great scenario and execute the part that we really would have had the gaps in making sure we're covered from our end. So as we work together, we developed the list of, who did we want there, who did we want at the table, and then went into our scenario. And again, really, really well received. We filled it up. We had a set number of people that could participate, and ours was just, as you can see, 1 day, half a day. And we had plenty of folks that joined it, that registered and signed up. So we had full tables of gameplay. Next slide. So when we set up for the exercise, we were really intentional. So as I mentioned, we went through and figured out, who needed to be here, who are our key participants, who did we really want to bring into these discussions that maybe hadn't been as active players as before, but would have a key role. So when we had everybody register, obviously we knew, where each one of these individuals were coming from, who they represented as far as the organization. And so we wanted to make sure we had the right mix of people at the tables. So we had 8 tables of 8, and we went down the list. And if you were public health, we made sure, you sat at this table and you had somebody from the hospital at that table with you, a first responder, whether it was fire, EMS, and somebody from the healthcare coalition. So we could all navigate this together and understand what each person brings to the table. And I think that was the biggest value of that, was eye-opening, being very interactive. And we wanted to have that interaction amongst groups and people in positions that maybe don't normally interact. We are creatures of habit. So when we get into a room and there's a whole bunch of people, we're going to be drawn towards the people that, we know. We might go and find them and sit there. We didn't want that. We pre-assigned tables and we're able to get the right mix so that it could foster some really engaging discussion as we went through the game. Next slide. So how do they feel about the game? I think Jamie alluded to it earlier in a slide. It really has set the bar. We had another tabletop exercise that we did shortly thereafter, maybe a few months later, and people were asking for the game. So I'd say it was overall really, really well received, right? So we looked at addressing the planning and knowledge gaps. And as I said, there were a lot of newcomers on scene because of COVID and turnover, and we hadn't done this for a while. So people had moved on or retired. And so things to think about as you bring those folks together. There's some really, really knowledgeable people in our community, but some people, this was their first time even talking about this. So it was important that, we saw people strongly agree that they had great discussion amongst players. And that was, again, one of our goals and purposely setting up the tables the way we did. Cooperation and collaboration. You can see only one person disagreed. You can see most people, for the most part, everybody was on board with what we were doing. There's always that one person, and I can tell you that the one person that disagreed just disagreed on everything. So that was, our one outlier. But overwhelmingly, people did feel more prepared for a full-scale exercise or even a response, and that was the value that the game brought to us. Next slide. So gave a little bit of the quantitative data, now switching over to qualitative. When we asked, for comments and feedback, pulled some of the comments directly from the surveys from the participants. And that's what we wanted to hear. We wanted people to be engaged. We wanted to have the discussions. People really enjoyed this outside that one outlier, right? But this was a way for them to actually learn and have something that they could remember. Because of the way the game is set up, and as Lauren went through that, you see consequences of your actions. You don't always see that when you're having a regular tabletop discussion. You're like, well, we'll do this. And we don't necessarily get to look at downstream effects. And that was one of the real benefits of this, is to look at, okay, we did this. How does that affect things, in the next shift and the next coming days? And so, again, really eye-opening for people. Next slide. So similarly, our lessons learned from our after action. As I mentioned, looking at those downstream effects, highly beneficial. Understanding roles. I would venture to say that outside of public health, most folks didn't understand what a community reception center was and what their role was. Even from the hospital side, again, that speaks to, we hadn't done this in a while, and there was so much else going on during COVID. This was, one thing that we pushed to the back of our minds that we weren't even going to be thinking about. And again, engaging and the interaction with the community partners. So where we felt that we needed some work was sharing accounting plans and resources. And again, some people know this stuff really, really well. Some people had never seen it. Some people didn't even know we had policies, plans, or procedures that existed. So that was definitely an opportunity. And then moving forward with collaborative exercises, we all seen that the HC model and BEMA's model, how that's supposed to work out. And we've done the training, we've done the games, but we need to continue to be collaborative and to partner together, because as you all know, that's the only way you're going to, really accomplish anything, especially when we're dealing with a radiation incident, is you're going to need to know who your partners are, who does what, and those roles before the incident, so you can have better outcomes. Next slide. Jamie, did you have anything else to add?
No, we're good. I just wanted to say thank you for this opportunity.
Thank you. We'll turn it over.
Next slide. So we already talked about, there were 2 exercises we implemented this at. Next slide. And here's just combined results from the 2 exercises. So, similar to what Elizabeth shared that they had at their exercise, we also found it from Austin as well. So both exercises, pretty much everyone wanted to play the game again and felt that it was a very engaging experience to keep their attention. Next slide. And people were able to identify their gaps in their plans. They felt that there was very accurate simulation of needs, anxiety, and the bottlenecks, and the scenarios were realistic. Next slide. And back to that original goal of partnership and collaboration. So everybody, even the person who disagreed with everything, felt like the game facilitated cooperation and collaboration, and there's discussion among players. Next slide. And most everyone was able to understand their role at the Community Reception Center, and they felt more prepared for that full-scale exercise. Next slide. And one of my favorite quotes I've seen is turning a naysayer into a yay-sayer is, I was negative when I heard about the game idea. I have to say I was totally blown away during the game at how well it was put together. It's so much better than any tabletop exercise, easy to learn on the fly. Well done. Next slide. Next slide. So for those of you who will be joining us at NEHA next week, we will be there with actual games for people to look at and you can play. And then we're also doing evaluations of this as a test. So if you would like to be an exercise host site for using it similar to how Austin and West Virginia have, then you can reach out to us at simpler@cdc.gov. Next slide. And this is a test is available today. You can scan that QR code in the top right corner, or you can use the website link, which has been provided in the chat. There's also a YouTube playthrough video. I know I saw a question in the Q&A about, is there a more detailed playthrough? That playthrough video is about 9 to 10 minutes, and it actually walks you through the different steps of the game. And then since all the content's online, you could look through the different scenarios as well, print everything at home, or you can take it to a professional printer Next slide. And I'm going to turn it back over to Myron. Thank you.
Awesome. Thank you. Thank you to our speakers for the great presentation. Can you see me? I can be seen. Okay, great. And just a quick reminder, you can submit questions by using the QA button below to answer your questions. Let's see. There is a question in the chat box. I believe Lauren, she's already mentioned the answer to that, so that has already been answered. The chat box is open for questions. Excuse me, the Q&A is open for questions. My apologies. Let's see, quick question for Lauren. Are there any, is there anything that we can look forward to regarding this is a test? Is there a 2.0 coming out? Let's see,
Yeah.
you're going to be a NEHA?
Yes, we'll be at NEHA next week, as well as hoping to build expansion packs. So, you know, we did a little bit of everything in the original This Is a Test, and so looking to expand for more, you know, rural and agricultural issues, thinking a little bit more towards, you know, also the big animal piece as well, what to do with all the pets and service animals that come, integrating other partners besides some of the main players we have in the game, as well as kind of zooming out and thinking about, like Elizabeth said, the bigger picture, incorporating the community reception center, but also other things that might be going on, like at the emergency operations center and at the hospital and things like that. So, you know, kind of thinking for the future, but also we do listen to feedback. So if you think something would be a great direction to go in, you can always reach out to that simpler@cdc.gov email, and we'd be happy to chat.
Thank you so much. Looks like we do not have any questions, so I will leave the remaining 2 minutes for any remarks that you would like to leave us with before we conclude.
I just want to say thank you to our partners who gave This Is a Test a chance. It was a very new, different idea, and I am so thankful that they tried it out, gave feedback, and you know, without them, it would not exist. So I am so thankful to Ashley, Marlon, Elizabeth, and Jamie, and if they have anything else to say.
It was a great experience for us, so I would just encourage any of you that maybe have the opportunity to do that, to do so. Sorry if I'm, you know, giving you more to-do list, Lauren, but it really was a benefit. So I would highly encourage anybody else to take that chance. I think you'll get a lot out of it. So thank you all for the opportunity.
I think we just second the same thing, and we're really thankful for the partnership with the CDC for being able to like take a random idea we had to help us through the struggle of a national exercise and make this happen. And the fact that it's really cool that everyone else enjoys it too. So thanks so much.
Very happy to be a part of it. I think it's something that you have to put in a lot more than a PowerPoint, and you get a whole lot more out of it. So great experience.
Yeah, it was a very good experience. We got such good feedback. It raised the bar on, you know, what we can do for exercises, and we just continue to try to work forward to live up to what Lauren built for us, which is an awesome game and more games to exercising.
Thank you all. Next slide, please. And a quick special thanks to all of our presenters for today. This concludes today's Nexus webinar. So thank you for joining us. And if you have any questions about today's webinar, please reach out to ehnexus@cdc.gov. This concludes everything. I hope everyone has a great day.